Hey everybody, happy Friday. I'm Dr. Candice, your board certified pediatrician and kid health expert. Today the word in the clinic is headache. And I want to just talk about what you need to know about headaches. Hey LaShanta, we have to talk. Hey Quita, you guys jumped right on today. That's a nice surprise. So anyway, headaches. And this is something that really worries parents because it has such wide range of indications in the life of your child. It could be something mild, not to worry about, but it could be something that is more severe or cause for concern. So we're going to try to break that down today, okay? So anyway, headache, it's head pain, right? And it could be anywhere on the head. And parents are often coming in. I've been seeing it quite a bit this week, and that sparked this conversation. So headaches can be broken up into two categories, and that's primary headache and secondary headache. Not to be too technical, primary headaches are usually migraine type headaches, which most people know about. Hey Natalie, and often can run in families, be family history, strong family histories. And this is a headache that usually the person may have nausea or vomiting or light sensitivity, or sensitivity to noise. And so people understand migraine headaches, right? When they have that set of symptoms. Also, you can have tension headaches. And so these are primary headaches. Secondary headaches are headaches that are caused by some other medical problem or disease, as we would say. It could be something as simple as, I'm sick with a viral illness right now. I have the flu, and my headache is a part of a bunch of symptoms as a result of that infection. But it can be something more severe, like a brain tumor. And this is what worries parents the most when they have kids with headaches. So it can be anything also from allergies. So I talk to parents a lot about kids with really bad allergic rhinitis, and they constantly have that nasal congestion and that stuffiness, and that can increase the risk of headaches as well. So also head injury. I talked a few weeks ago about concussion. So if you hit your head, you're going to have a headache, and we have to tease out if that's something to worry about or not. So headaches are definitely worrisome. The most common cause of them are headaches related to illness, colds, and things of that nature, allergies, stuff like that. So by far, most headaches are not cause for major concern. But we have to be skilled, and we have to know what to look out for to take our children to the doctor when it's something we should be concerned about. And the doctor has to be skilled to pick up on those warning signs. So let's talk a little bit about what that could be so that you'll know what to get your child in for. So my kid has a headache. I'm not really worried. It's rare. It's maybe once every few months. I know he's sick right now. This is rare for him. No big deal. He really didn't get good sleep last night. He didn't eat something. I think I know what the cause is. I'll give him some Tylenol, tell him to rest, hydrate him. It's gone, no problem, right? But if your child has worrisome symptoms like headaches that are becoming worse, more frequent, the symptomatology of the headache is worse, and something is changing with that headache, then that's cause for concern. If the headache wakes the child up out of their sleep, or they wake up and the first thing they feel when they wake up in the morning is a headache, that's concern. If it's a nighttime or morning headache accompanied by vomiting, that may be a sign of increased pressure in the brain. Also, that's cause for concern. If they have any neurologic problems with their headaches, like I can't walk, I'm off balance, I have changes in my vision, hearing, anything neurologic, weakness, that's a problem. If your child has really high fever that's prolonged past 4 or 5 days, neck stiffness, then that is cause for concern. We worry about meningitis, okay? So those are just some of the things. And if your child has a serious medical condition, already and they have the worst headache of their life, or they have a really bad headache, you might want to get that checked out too. So those are the warning signs that we don't want to let go and just keep them home and give them some Tylenol or ibuprofen. But other things, you can kind of monitor it. So while you're monitoring the headaches, what do you want to look out for? I always tell patients, families, to keep a symptom log. You can track symptoms of anything in your phone, in your note section. There are symptom tracker apps out there. And you just need to keep track of whatever this is that's bothering you. So we're talking about headaches. You know, every time there's a headache, you log it in your calendar or note it, note where it is, any symptoms that go along with it, such as nausea or blurred vision, what you did about it, did you give Tylenol, and when was it relieved? They went to sleep, they woke back up, it was gone, it was there maybe an hour. So you want to note those details. And over time, as you're tracking those headaches, sometimes you will be able to pick up on triggers. Oh, I noticed this is happening every day when you come from school. Or I noticed this is a morning thing. Oh, it's around lunchtime. Or after you always eat chocolate or whatever. So oftentimes that will help the doctor and you figure out, hey, Letitia, will help you figure out triggers for headaches, especially if they're migraines, because migraines are driven sometimes by triggers, okay? Now, don't automatically assume or demand that your doctor get this expensive workup. I need blood work, I need a head CT, I need an MRI. Oftentimes, in most cases, that is not necessary, okay? We don't want to put our children through unnecessary tests. It costs money, and we often can find things that aren't even related in the first place, and it just makes it all confusing, okay? So let your doctor explain to you and decide if imaging is necessary, and oftentimes that's based on a good history and physical. That's why you need that log to give them all the answers to their questions, and that's why you need to tell them about any really worrisome warning signs. So the information you give to your doctor is really what they use to determine what needs to be done. And also through their physical examination. So you may or may not need any imaging. Don't just assume that that's an automatic thing, okay? You want to follow up with your doctor on the headaches. So if you find out they're allergy related, take that regimen that the doctor gives you to treat the allergies. Often headaches can be just due to dehydration. The child is not hydrating well. They are not eating regular meals. They're skipping meals. They're not getting enough sleep. So it's just that lifestyle that needs to be adjusted. Too much screen time. They need an eye exam. It could be vision related. So there are really simple things that can trigger and cause headaches that we can modify in our lifestyle to improve those headaches, okay? And so you want to follow the recommendations of your doctor, and you want to follow up to let them know if that worked or it didn't work. Sometimes if those headaches are so frequent, 4 to 5 times a month, even if they're not super bad or super worrisome, some kids are just having headaches that often, and it's a period of time in their life. That child may need to see a neurologist and may need to have preventive therapy outside of just the as-needed pain reliever, okay? Because you don't want to overuse those medications too much. They can actually cause a rebound effect and cause headaches. So work with your doctor to determine the level of severity of the headache, the type of headache, the treatment that is needed, any workup is needed. Keep in touch, follow up to determine if there's any referrals that need to be made, and to make sure that your kid is okay. All right. So that was just a quick and dirty about headaches and some things you can do to make them better, lifestyle things, warning signs to look out for to get them in right away to see their doctor. And then also things, little hacks that you should do about the headaches to make sure your child is getting the care that they need. Okay, because this is a common problem in all people, but it definitely can start in childhood. And as a parent, it's very worrisome, and we want to know how to handle it in a confident way and not to be in a calm way, not to be too anxious about it, okay? Have a great weekend, and I hope this was helpful, and we'll talk next week with the Word in the Clinic.